third time's a charm. Kaya pigapat liya kung nasa ko kama, mamaya na tana, akang medyo ko takakay nadunit ni udlango yo. Kasi ano pimakin mo udlango yo, kati kong nakata, udlako tiya pa kanuna bumiutan. Tana tusang nangit yung kalwa, pigya ko tigin yarak ko, nuvan no jua, pidyo tigo, kasi ano tusala wata, tusak titaw kawat tayo udlango yo, mako panot yo, nuvan no jua kanto, nalunat taw kawmata, isumagivavon. Amatan luta Patterson unikala kung nalunay tiyan na pao takwa pidjutigidjugan nirupino kulo kolwa katatan na ko veso vimo tikitaw na nita nuna litin katinga kataw na nita taman na kago mako hukumaitu sumayo kayo majo nuna bumiotalo taman na kayo majo guma ko veso ko vegino para kasi utusin na katakako nuna livo katinga gundang na nitin Kasi ano, Akeeagok yatin ni, ukiyo yatin ni la tana atu jangin nako. Pingwa tunurun na jangin na tayo tana ida kulupon nuna livon ulugan atu me kunatigo pidju tigin yakatigo. Tana kubya suve tikidok tidlego nikago suve hamnitin ipinyana naman. Tamakko nikago sunako chakkuya hangit yakatigo. Tana piduang atu me Omicron kanata limame sakit padliya yung ulugan ng ningane tusak padliya dota pidju tigido nika gusuin na kaya kung nakata piduri padliya tidlo tako ninga kayo matya pagod tayo tako atul ko yaw si mayon udumi mo tigit sigo luta Patterson pidju tigido ang wasawen tako kina po matwa si magya kang ningin ama kapiyagun naroten Tako pinupangum mata saya makum lagu taman nuvan nojua 19 ngayon Nunavut iluan taman Nunavut miutaleman tako nga tigumyangin nako bakka sibunitin kayo sibadlian natin lota pido ang wato mi tamakwa outla kaya kangitun outlang idloten kapiyagun natin tako ida kulungit tayo kapiyagun naroten Tamakwa kata go tigi jaw katato nunalitin miki jume ko jaw si mayon malit lutigon takwa kina tin matwa ko ten atok tawin nakatadloten amatakwa akang kanim matto kakasugi jaw gun nuwan no jwa kakasugi jaw gun kawi gata ko tigi lote takwa kala jaw loten tamakwa udlumi tikitsugo Luta Patterson asoko data si mamman Nunavut miutanen ulugan ato me kunatigo Akeeagok mako piduang wato tamakko ato ako jangin malako jangin kajusin na kaya kami nakatigon sibunitin tamakko kuyan na may kumanapango nga udlango yung asoko data si mamata amiso nunalitin nito lutan Anya sotin, amma tusang matitigi katatavu nunalitin nito aswal koyan name. Tamakwa nunalitin angin pami tau tupavon ubatin ulugan automated simangin matam. Kingud lopame kovia suvikululu Nunavut miute kovia suvimi isumagitian yapavon nikagusun yapagon ilagitigon tana ulugan automated kumitiagatigon kovia suvikululu yatilego. So nirum niya pong taman na Akeeagok niya tatin agyat mo kayo sitya kuguminan niya katam. So kuyan na ma'am. Good morning. Udlakon tapaka Nunavut. Unfortunately, we are going into the holiday season with some concerning news. As of this morning, Nunavut has 2 positive cases of COVID-19. There are 2 individuals in Pangnirtung. This was announced a few minutes ago, and Dr. Patterson can get into the specifics if necessary soon after. I know that many of us were hoping for a more normal Christmas like the one we had prior to COVID-19 pandemic. As anyone who knows me knows how much I love the holiday season, especially the Christmas games. But this year, I will not be taking part in any games. I want to do my part to keep my family and our community safe. Once again, this holiday season, we must remain vigilant. It's not time to let our guard down. We are seeing mounting cases of Omicron across the country, and the statistics are alarming. We know following public health measures, wearing a mask and being fully vaccinated are the best ways to protect our territory. I hope that every one of you does your part to keep Nunavut safe from COVID-19, which includes avoiding unnecessary travel, getting vaccinated and encouraging your loved ones to do the same, getting your booster shots when possible, keeping your bubble small as you celebrate the season, and avoiding larger public gatherings, wearing your masks, keeping your holiday bubble small, but also getting tested and self-isolating if you have any COVID symptoms. Dr. Patterson's sound judgment has kept Nunavut largely protected in the past 2 years. We need to keep following his advice. The people most impacted by the pandemic have been our frontline healthcare workers. I want to thank our nurses, our doctors, and community healthcare providers for their tireless work in these past 2 years. You continue to be our heroes in our communities. Finally, I want to wish everyone a happy holiday and Merry Christmas, and to remember that the best gift we could give is our family's good health. Be kind and be safe.
Blacha. Ibud lapamik Pangnirtung ihumagiwapi amalu akong natuko pinalunang mat ataw hiyo katigiwapi. Piga ako takawa tungobla ilita kay huwag sugit at nakatay chikut pilira yiluk tangit. Taman na nuwang naluak nunaluak siya magkimalak tidlugo, pitakalak tidlugo ilak, temang aning hakilak tidlugo, pilagay ako tibut. Ako ko'y nakimak mata, takaliluak tuyak himang isu tidlo. Pilagay yuyuhi, kaway magiti, taman na ako ang nirahimayahi, atutikak himalakik to, nunabumyo tao katipinot. Ang malu, uwagut, nunabumyo tao yutigut, kung atak tisluta, nuwang nalwangmik, akira tisluta ilak, ukwa pilere yid, akok hemanak pango ko mata. Ikakanik, amihunik, pilere himabuhi, amma, kikahualaw kalwak suhi, nok kangahualaw kalwak suhi, pilere tuin na uyak himagapi, nalunang ngipmat, aglaat kuya hung naw ni ngani at natin ilitit sikut pilarigit ilangit tayo mahuli pilari ni akput ami hiutigut nok kangan niya kalwak tisluta kaway makuha pilari yuyuhi ikayok himang liwakap pinunabum yung tao katipinut taman na nang nga kay baka upigi baka piyod lakit to kila taman na mat na kuyan namig kuana Kuya lihimang liwakto ko ilipinot, pilakayiyo yun. Mana, higulak tigiyap ta, okawhik karayay maliksugit tao. Kuya naluang itumik, tuhak titihuak pung ano na bumiyunot. Mana uyok. Taman na at natay dito sinariyabot nuna buming. Ako kong naktumihiyok man. Ako lakik Manila at nakatilitit sikut pilarid juhe pilarid juta nunavuluk taadaw tuksugu maannaw yumut qanitukut qanittumun takunayaqupta amiga khillaqi kaptanila pilerijinik uktuutigilugi najanguanik amma hingit nillu amma tamanna akkoro tigiinnauyaq taqimagaluaqaptigu taqqanneqaangaqtunik ukiunneqaangaqtunik hiani huli amiga khillaqippugu pilerijinik tamanna pidjutigillugu pileriangutta hortuugaluit atuinnauta hortuugaluit annaarvignik munaqhiqarvignik aaniasiutikkunnik kanunavuiluani atuinnauta hortuugaluit mikligaaq himagaaqarnaaqmata quviahungnauninganik ammalu ukiumunutaamut tikillugu iluanulluuniit mikligaaq himaniuniartut ilagiyaqarnaaqivut kapyuinarmik kapyuiniuhortut qablunaatilu vaccinations ilagiyoblutik nuvangnarluartaariikkut kaput amma nuvangnartaariikkut kaput uggornaqaluarpoq tamanna kihiani nuvangnarluarpidjutigillugu nunarlualuktaamillu pitaqaleq himatillugu kanadamiutaoqativut akkorullarik matattau aviktoq himaniuyut pileriiqatsianginniaq pidjutigillugu akkorutigiinnauyarnaaqaluakkavut tamanna pileriitaakkannereaqarneq atnaarteelititsiniu iluani maanna nunavummiut apeqihualerpakka ukua pileriyiit akkooq himaningit ilitaqittialaorlavut ammalu pileriyiit atii ikajortoreekkanilaorlavut pilerikkannerealerta nuvangnarluaq ihumagilugu nautsertuptiarluta ujjaqahuttiaraarlutallu qano uluqianarninganik ukua eqqaumatsiarlugi annaarteelititsiikku pileriyiit tamanna Omicron nuvangnarluaq nutaaq nguninga haqqiumalertikugu annaarteelititsiikku pileriyiit akkorornartumihiorq matattaumaannauyoq immaqa taqqarnik pinahuaqoherneqaiyunik nunavummiut ati apeqivappi quviahungnaugaluarninganik tamanna nuvangnarluaq ujjeritsiareaqqiuk nautsertuptiarluhi uluqianartumihiorq tailigiaqtaritti kappiahuqoyingikkaluartunga kappiahaarinilungittunguugaluaq kihiani huliyoq tamanna nuvangnarluaq nutaaq Omicron ngunerartauyoq nutaangugaluaq qauyumayaulerpallialihaarlunillu kihiani nuvangnarluaq qauyumayavut qanu iliqqauhiqarmangaat ammalu qauyumayavut qanu uluqiananginneqqarmihiorq tituulluaq mangaartaa uvaptitnik ivulertigiyaptau qauherianihaartangit malitsiarlugit amihuuluartuni katiqatte qaluartailigiarluta aullariaqangikkaangapta nunali ahingitnut aullaluartaililuta nuvalertuujarnerupta aniartailittarluta ipyaqotinik matuanik atuinnauyariartarluta iteqhimajaraangapta iglumiutauqatigingittaptitnik iteqhimaqateqaraangapta kapiyaugiartarluhillu nuvangnarluartaariikkutauyumut ammalu aggahi ermitsaartarlugit uasatsiartarluginila ati pilerikkannequvappi ilagiyahi nunaligiyahillu nunavuluktaarlu ihumagilugi tamakkua uloqianartumihio quyingillarikkaluaqapta tamapta tukihinnaqman pianilerlungaugaluarlu quviahungnauninganik quviahutsiaquyillarikkaluarpunga quviahuqunnaqmata nunavummiut hulluaqunnaqaluaqmata kihiani quviahuujarlutalu katiqatiqartaqaluarlutalu uloqianangitumihiutsiartuulluaqaqta atautsikut tamakkua atoqtuulluaqaptigu isuaqqaiyerju atulerti himayangi ammalu quviahungnaqhiutsiarluta tamakkua atautsikoortuulluaqmata ihumagiyakkut Kuya hung nakhiut siyang na puhi, amalu ukiyo munutamu tukat siyang na puhi. Mat na. First of all, I'd just like to mention to all the residents of Pangnirtung that I'm thinking of you, and I know you're in a tough situation at the moment, and thoughts are with Pangnirtung. I want to begin by recognizing all the health staff who have been working tirelessly over the course of the COVID-19 pandemic. Your efforts have been vital to the success Nunavut has seen in the battle against this virus. You have all put in long hours, and many have not had an opportunity for much time off. Some of you will continue working over the holidays, and I want you all to know that your sacrifice and dedication to the care of Nunavut, it's incredible. Really, it is. Matna, Koyanami, Koana. I know I and all Nunavut are grateful for all the work you have done and will continue to do so. My message for Nunavut at this time is that unfortunately, our healthcare system is stretched extra thin across Nunavut in the short term. Our staffing resources are limited, and although we have been working hard to recruit and retain the health professionals needed across the territory, service reductions will be felt in many communities over the holidays. This includes some reduced access to vaccinations, such as the flu vaccine and the COVID vaccine. Our challenges are related to a national trend in health staffing, where the pandemic has negatively impacted the workforce in many ways. I would like to ask Nunavut to recognize the incredible effort and sacrifice our health staff have made and the stress that health staff are under at the moment with the threat of the Omicron variant. I am asking Nunavut to do their part to stay safe from COVID over the holidays. It's true that Omicron is a new threat, but we all know how to stay safe. We can keep gathering small, avoid unnecessary travel, stay home if sick, wear a mask, get vaccinated, and wash your hands often. Please do your part to keep your family, your community, and our territory safe. In closing, it's Christmas. People should be able to have fun and celebrate. I believe it's possible to stay safe and to celebrate the season if we all stay vigilant and remember the lessons of the past year. I hope everyone has a Merry Christmas and Happy Holidays. Matna.
Good morning. In light of quickly changing information about the Omicron variant, we have had to make some difficult decisions. We have rescinded the recent order to allow communities some larger gatherings over the holidays. This decision was not made easily or lightly, but it is necessary due to the increased risk that Omicron poses. Evidence shows that Omicron can spread very quickly, even amongst those who have had 2 doses of vaccine, and we do need to change our response to match this increased risk. We strongly recommend against all non-essential travel at this time. Those who choose to travel and return to Nunavut with their proof of vaccination are asked to isolate at home for 14 days upon returning to the territory. This includes avoiding gatherings. Everyone should limit their visits to congregate settings with at-risk individuals, such as elders' facilities and long-term care homes. If you are planning to gather, please do so safely and keep your social bubbles small.
Sakut tamat kuasit sak palyayo to sak palyayo bupit juti ilugita sumanumat yung 19 dan asit sak palya si mayok Omicron ngunirak tayok ayok nakto na isumalirot te harahas simalirata khilami uyuk ko tan na kuya na tagot man na malitaw ga halok to nunalit amisunok sa katigun naktikay na law kalaw atigo khikak na utilugo tan na isumalirot tigiga hakhaw gatigo asit sak tawlo ni ayok na kalaw atilugo kisani tay may ga hakata taman nuluga nakto ni utagun nak ni nganot Omicron no wadya na kutiyo Kawin na si mamata na Omicron khilami alok ko sa mapalagom nak ni nganik wala ta ko nga makon ni kapiyaw si mayugalo anik tay may message ga has si magatigo ta nangum matigom na hulugo taman nuluga nak tumigo tagun nak ni nga Sangi yumik atule kuyugot awla kaya tungitut mano yu awla kata hungit sugit. Tai ko alo awla tuin nang ni atut ambalu Nunavut motir ni atut nalunay ko tahalo ti kapiyaw si maguti minik. Tai manit tay liga rea halak tuang ikarotik ulunik 14 nik Nunavut motir si malikuting. Taman na ilagi ya uluni tamat ko akati kataw na diyang itut. Tikko lima pula kaya katigilo akata nilutik kisani tamat ko akati ngageli katingagom nakalwang lutik. Suluin na ko vimitut, ubalay pigiyaw vimitut. Tay mapamnan niya ako sikatilang nit sinik at ulugan ak tumitailit siya lo siya maluta ko ino kati katang na akta si katsinaw katang ting.
For those communities planning to hold events such as games in arenas and community halls, these gatherings must fall within the current gathering limits and should not exceed 50% capacity or 100 people maximum, whichever is less. This is critical to slow the potential spread of the virus. We also recommend against inter-community gatherings and travel. If you travel to other communities for events or to visit, you increase the risk of spreading Omicron within Nunavut. There is a strong possibility that we will have to cease travel in and out of a community should we identify a positive case of COVID-19. Anyone who travels to another community should be prepared to stay until travel restrictions are lifted. This is necessary to ensure quick containment of potential Omicron infections.
Tay ko ano naliit pang nasimayo katitit si katalang ng nunarin ni solo pingwatit silutik anikit to bimmi balupingwa binni malit siya kaya mana yu isilut tabiyo titaw yun hatsigun nang ningin abang itay no hakon nang ningin ito nga tano tayo lilutik o balo 100 ngugun nang lutik ami sunap pa ngugun nang ningin nalya to yun nakatan na hatsinaw naksamalit tayo luni taman na pimariw na tusuk kay liya tayo gun na hulugo taman na sama palagom nang ningin no badyoang na atuloy ko yung ibugot ako ano nalinot asingin not Kati katakhunagin amalo awla katigi katakhunagin asingin nunalinom na ato arutsi huga subin miluni taman na uluga anak tumitit sigun na nga sa matitaw balagun nang nanganik Omicron tamani nunavumi kay maagtakwan nukatit siga katwin na ahang naktigut awla katakun nang ninginit ikitaw katakun nang ninginik nunali lalo na sito ako tanu wadyo anak 19 linik kinatuin nak asingay no nunalin no niyok gune ako ni tayo maupalungan sa magyalik awla kuyaw gune kaya nga utitay li kuyaw gune lo ni tamak ko isulit tabiyo yo kuya nataw lang ngin tamak ko solo tamak tayo mailiw ka hakatigo taman na nuwadyo ang nak Omicron sa mapalya sa utigi kunago.
I cannot stress enough the need for people to follow the current public health measures, including wearing a mask. Evidence shows medical masks are effective in helping reduce the risk of contracting and spreading Omicron. If you cannot get a medical mask, 3-layer cloth masks do show some success in limiting transmission. Symptoms with Omicron can be different from other COVID-19 infections. It is very difficult to distinguish Omicron from the common cold. For this reason, at the onset of any symptoms, including cough, sneezing, sore throat, runny nose, please isolate and contact the COVID-19 hotline at 1-888-975-8601 to get tested.
Sangi teema uharlunga utako kikkulimaat malitsearea hallarilerninginnik aanaaharnangittulerinamu malittaa huyausima kammalumatuarsimainna hattahuyillunga hauyinarsimamma tamakkoa matuat atuutiqatsearunnarninginnik nuvajuanartaartailitit sinermut ammalu searmartailitit sinermut Omicronmik taimaitumi matuartaarunnangik kuvi taima annoqaatsajani taima matuani pingarsiulingayunik taima searmartailitit sigutiugunnarmiyu taako hanuigutiugunnartut Omicron mut ajiungilammata taatsumunga asinginnu nuvajuanaq 19 hanuigutiuqattalortunu hanimmaguteqartunut ayornassunilu taanna Omicron suurlu nuvatuinnartutituutuinnareahanga nuvattutitut tamanna pidjutigillugu hanuigutiqalituarutsi suurlu huissuqattarutsi tagiuqattarutsi iyaarlukkutsi qakkiliqattarutsi anitteilit-sautigigahartusi taanna nuvajuanaq 19 ungasitsumi qaalaviugunnartaaqihangittumut uqaalaviuluni 1-888-975-8601 qauyisartaugumanerarlusi.
There are simply too many unknowns and too many risks that may jeopardize Nunavut's health. We do know that people who have received their booster shot are 75 to 80% less likely to experience severe infection or hospitalization due to Omicron, and we are strongly urging everyone to get vaccinated. If you have had 2 doses and you're eligible, please get the booster. Protecting Nunavut from COVID-19 is everyone's responsibility, and we must continue to work hard. It's been a long 2 years. I know everyone's exhausted, but it's not time to let down our efforts. We have to remember that health and safety is based on the layers of protections we have put in place. The public health measures, wearing masks, isolating when asked, and the vaccine all combine to create a shield of protection against COVID-19. These must be done together because each individual layer is not enough. I'd like to thank all Nunavut for their patience and cooperation. Happy holidays, Merry Christmas, and I hope everyone stays safe and healthy. Thank you.
Maannaoyorsuli hauyimanangitut amisuuluangata amisuuluartutilluulureanartumigutaugunnartu tamakkua Nunavummi hanuigutigigunnarunnartangit hauyimagaluartigu tamakkua pingajoanni kapiyaasimayut 75% mik 80% mut taima hanimmalua teiligutiqarunnartut ubbaluaanniarbinni uniteiligutiqarunnartut Omicron mut taima kapiyaasimatsiaruti pingajoanni sangiyumik ajaartuigiaqqugu kikkulimaat kapiyauqullugit ammalumaqqorti kapiyausimaguvit pingajoanni kapiyauqujaullariputin sapumit siner Nunavummi nuvajuanaq 19 taartailitit sinermut kikkulimaat pileriatsarimmauk ammalupit atseruutiqainnariahartugussuli akuniussimalertuugalua taakkua aaqqaaguumaqquu qauyamalluta taqassimalerati kisiani maannaujoq taimaak suli teimailuureahartugut sapujji valliagasuarnermik iqqaamagaaharat tamakkua hanuitteiligunnarnivu attanartumiitteiligaaharnivullu taimaa hulliriilingajuni sapummijaujutini atuutiqarngata tamakkua malittauqujauhattarsimayut aanniaharnangittullerinermut matuarsimaqattarneq anitteiliqattarneq taima anitteiliqujautuaruvit ammalu kapiyauqattarneq taakua katirsussugi iluunnati tamakkua sapummijaugutiu nuvajuanaq 19 mut taima Katillugilu nati kamagiyaw hangata kikkulimaallu taakkua ilauqataulutik teema ikayuqataugunnartum. Oyannameerumiyakka Nunavummiulimaat utaqqitsiarunnarsimammata ikayutsiarunnarsimammatalo. Rikarnami huviasunniaqqussi huviasubbimmilu huviasullusi uluaanartumi teililusi qanuit teililussilu.
Is this on? Excellent. Dr. Patterson. Kent Driscoll, APTN National News. My question, you mentioned during your comments about a 14-day recommended self-isolation or isolation period. If you were to take 14 days from today, that puts us at January 4. There's a lot of employees who are out of the territory right now for holidays. I'm thinking specifically of teachers. How are schools going to open in January if everyone returning to the territory is expected to do 14 days in isolation?
Kentriskoi PTN kunniuqaqqauguvitakku tikittuyutirtuiulluni 14 yanitteiligiaqarnerarlutik imminik taima ulluni 14 nimaanna pigiarlugu January 4 mutikiyutigayaqatta eqqanayartirasai gavamakkunnu qikariarsimammata qallunaanuk ilinniartissijillu taima utiqqataqanurli taima matuirunnalaangata ilinniarbi taakkua anitteiligiaqartillugi utersimaliqtillugi.
Oyanami kan tan apaqutitiava itia kisulumamana qimaqqugia haqattigu qaayumajigu attuqtau niartun amisun tan ilinniartu lerijivu piluanguartu qaayumattiartavu qanukturuaqniarnittinni tan sivuluttilimanu isumassarsiuruyautiareaqniarman piluanguartuma iqqana ilinniartu lerijiku ministunga misquas pijjutaqarniarmimman so tan kiudlarigia manna ubdaanguyung ayungnartamni. Everything's on the table right now. That's obviously we realize with the information that's been provided to us today in terms of the concerns. So obviously there's many employees that will be impacted. So that's something I very much look forward to working directly with the Minister of Education specifically, but also the other ministers that will be impacted. But right now there's no response I could provide specifically to that.
Koyanamik, my next question is for Minister May. It's a follow-up. Minister Main, during your opening comments, you refer to service reductions at the health centers. You mentioned vaccinations. I wonder if, could you put any finer point on that? What do service reductions entail and what's that going to look like in communities?
Minister Main, no haqqaugavi uqaussaqartillu tayitaaqua piyissirauti mikilligiartaussimaneangata piluartumiaanniarvinniallaa kapiyauqattartu tamakkuunakataussimaneangata pilirigunnarningi tamannanalunairaakkannirunnaqqiu.
Yes, thanks for the question, Kent. It really depends on the community, what the service reduction would mean. In some communities, health centers will be on emergency-only service. And it depends on the community how long that period will last. So there's a range. In some communities, there's enough capacity that vaccines still will be rolling out in limited quantities. So it's a hard question to answer looking at the whole territory. But generally speaking, there's a range of service reductions that will be felt by Nunavut, including here in Iqaluit. And in a normal year, that's not entirely uncommon, but things have been exacerbated a bit, a lot by the national trend in healthcare staffing that we are feeling. We're feeling the pressure that healthcare providers across the country are feeling in terms of we need the staff to deliver the services, and we're doing everything we can to deliver the services that Nunavut need. Inuk doktor waktu itu mana nalunang itjang na man. Balun inuk doktor lagu. Okay. Ikan teman apa kau tiga ni mana Nunavut luk tata utuk sugu ajiging itu ni mikigak hemaniunak tu ni atong naka atulak titaw yung kang nato ilangit ni nunaring ni tuawang nakto kihimi takuyaw yu luak kang nak mata kablo natin to emergency only taman na atugaw niya so ni nunali ahingit ni ihe ni nunaling ni angin kang ni kay tamakwa kapok taw yu luang ni huli atwin naw niya tut kobe hung naw galuang ni ngani ihe ni ajiging itu nunali atau kaya kang na mata teman na pidjuta uluak so ni pilari katsiangin nak watsyang lu okaw heri laok sugu Canada miu tau katibut temat tumingat tau tulok tau tau yumik atok mik mata ate iliti chi nani lukta Canada iluani ako mata tau pilari katsiangin nak pidjuti giblugu teman na okaw heri baka tukin na siyang okay.
Hi, Teresa Khachuk, CBC News. My question is for Dr. Patterson, and I'll ask in both languages. Patterson, pinaswa ko sirme, hawzi ka sa wasungum mata, hanu itu mga novakjuak na, tako nalunay kitaw si mazo, pangnirtung me Omicron ngupata, hanok le anya hak nangituloy kinik mo maligangi asidji lang aba. It takes a week to figure out what strain of COVID the positive cases are. If the cases in Pang are Omicron, how will health restrictions change within the territory?
Right now, they're only changing for the community. If in the past few months, when we've had introductory events, we've often not changed the measures at all. As of now that the concern is, now that there's significant concern that it's Omicron, we're changing that approach.
Mana yotan na nunalid ni tapikani kasi ay tamakwasid siya tao na ati malitaw galit. Tapkigalaw si mayuni nuwadjuan nakto hata kalawati lugasid siya tao hata yung ikalawang at tamakwa malitaw galit. Kasi ay taman na isumalong na lakilam ng Omicron ito yung nakaham ng tamakwasid siya tao sa utigilak to eh.
The end result of that change in our approach is that we'll be bringing in smaller group sizes with a single case, and we'll be much more likely to introduce travel restrictions in and out of any affected community immediately once we've identified COVID-19.
Ay matakwa akitaw gayaktu tamakwa sulo katsinaw hatta haluti kati hatta unaktu amalo ta kwano vadjuan nakta tuminalo na tayo hatwa kanunalin ni tikibiutele hatta yigil gayaktu amalo aulat tele gaya halakluti gayaktu.
Manaw til logo sukat to ni hawzi sauti ni atuin naw ti chilang avisi kikko tuin nakno. Will you make testing kits available to the public at this time?
Sorry. Right now, the only, I assume you're referring to the rapid antigen kits. The only ones that we have in territory are not suitable for handing out to individuals because they come as a bulk package with only one bottle of the chemicals involved.
Mana yung takwa hila may yung kuhawi sauti yung nakto takwa imiko tilugi tuniya katagun nang imata takwa po kataw sa mahatang at katingaw suti kamalutan na tayo matahime matuniya katagun nang ito amisu mata takwa katingayo ikaw yung sakta gutingin.
We are looking into, we're pursuing getting a supply of the rapid antigen kits that are suitable for handing out to people. First priority would be to distribute to people on arrival from the south, and then expand from there if possible.
Tana takai yung gaswapto tamakwa imbiku pulhatau sima yutuni hatau hatau nang mga tay minakawi sa kutisa gunakto tako sibuli jaw hatau yakto tamakwa tikip palya yutamaw ngano na bumog tay makawi saktaw chawti gutin kawi saktaw hatau nalang mga ta imbiku kawi gaswaktabo.
It's important to remember that those home kits, they are not a substitute for isolation and for other measures. They're an extra layer of protection, but they don't replace anything else that we're doing.
Kamaga hospital ta ko ang kami kawi sa kutisa yu kingo beauty ko na jang mata tamakwa kasi ani hakan ni go sa pumbiyaw guti to na to amalani tayle ng kingo beauty tamakko ni nga malitaw gali ni kingo beauty ko na jang mata tamakwa imik ko kawi sa kutin.
Good morning. My name is Corey Larocque from Nunavut News. I think this question is probably best handled by Minister Main. My question is about the message that you sent this morning urging people to get vaccinated, but vaccination reductions or reduction of vaccinations is one of the service cuts that's going to be cut. How do you reconcile the advice to get people vaccinated with the fact that vaccinations is going to be one of the service reductions?
Corey, kaya ano na siya news kunida na hakaw gabi ulasa kapiyaw hatta ko itsusi kasi anitaw piyit siya raw tini nakatitaw na na sinakaw luti hanong lita magko kapiyaw ko itsin na piyit siya raw tilo nakataw na tilugi hanon nalo na rekan na kayo.
Yeah, So the reductions in services have been, we've done everything in our power to keep our health centers and our facilities staffed. We've introduced a number of initiatives, and so the service reductions have been we have worked to reduce those service reductions and to keep as many staff working through the holidays as we could. It is unfortunate that the vaccination capacity is reduced as a result. And at the end of the day, what we are facing in terms of our capacity limit is a short term. It's largely confined to the holiday season, and in the new year, for communities that are on emergency services only, in the new year we will be getting vaccinations resumed for those communities as quickly as possible. And I do want to reiterate that wherever possible, wherever we have the capacity, we are continuing to vaccinate throughout the holidays. And so this is not something that has been our choice. It's something we've worked to avoid, but it is where we are at this point in time. And how can we reconcile those two items? Vaccination is a great effective, safe measure to reduce the risk from COVID-19. I've had my booster dose. The Premier's had his booster dose. Vaccines work. So we wanted to keep reiterating that message regardless of the service reductions.
Tako mikiliga to si maning ibig sa kautiu ni atu kay mga kimaw magaswas mayakalo agu tako ala na bime kanayak ti kakaswag katu inakata tamako sakit to si mayad jiging itu pilirang kataro nang na atu pijit sa kautiu nakataw si magalawak tilugit kanayak ti kakaswag garnit tinut kaman na piluang ang niyang nakikang na tilugo ugor na tu galo tamako ilang hindi nunalin ni kapayaw kataro nang ningi tamako nakataw si magaham na ngata iqanayak tikitsarnikumun kisaani tamanna rikarnautillugu khuviasubbimitaimeilorniarngaat qayimaquiyunga tamakkuanunali piluartamituavernartukku kisaani ipattauhat ilaupabiuqattarunnartu aanniarbingit January mikapiyaukkanniqattarunnarsilaartuugaluat iqanayak tikitsaluarunni iqqata taimaimmat tamanna himaumagasuarumaluartaqaluavu kisaani tamanna nalunaarsigiakkanniinnarumayugu kapiyauqattarni tamanna atuutiqatsiaangat ulureanartumiitailititsigunnanermut ammalu taana kapiyaussimalerturu pingajuanni ammalu sivulerti kapiyaussimaluni taimaa ajauttuivu kikkulimaa kapiyauqattaqullugi pingajuanni taimaa nalunaarsigiakkannirumajuinnartugu.
Just a quick follow-up then. Thank you for sharing that you and the Premier have had booster doses. Do you anticipate that having a third dose will become the new norm? Are we looking at a new definition of what it is to be fully vaccinated? And are you going to expect both Nunavut and travelers to be having the booster shot?
Taana pingajuanni kapiyaussimagiaharner taimaa kisiani uliqpallianiaqa taimaa pingajuanni kapiyaussimaluni taimaa naluneertauqattalerniaqata atangertumi kapiyaussimalernitni tamaani nunavummiutaullu tammalu aullaqattariaharniartu pitsutigillugu.
Thanks. That's an open question. The evidence is still being assessed around the vaccine and appropriate definition of fully vaccinated, and will continue to follow national guidelines and recommendations on that. And currently it's still 2 doses. Kiujatsauluangittu kisiani qauinarsima tamanna atuutiqarninga qauisartauvalliajut kapuutiimitsaanut qanu tamanna atangertuni kapiyaussimanerartaugunnalerniarmangaata taimaa kanatalimaami malittaugiali tamakkua qauisainnalangajavu qanu atangertumi kapiyaussimanerartauqattalilaarmangaata.
Trevor Wright, Nunavut News. To continue on the topic of boosters, for those who don't actively go out of the way to research this, how do you explain the idea of a booster shot to someone?
Trevor Wright, Nunavut News kunni tamakkua pingajuanni kapiyauqatteriali pidjutigillugitaanne qanu pidjutillaringinnik naluneeriaqu.
Think of it as a top-up or a reminder for the immune system so that our immune system has better training to recognize the COVID-19 virus.
Taana suulu iqqaigutigilugu tamanna iqqaititsigiaqutiujorт suulu timittinnut annaumatsutivu tamanna iqqaititsigiaqutiujorт taana pingajuannu kapuutimut suulu qauyimanianga timivut kisumik sapummigiaqarmanga tamakkuninga vajjuanarmuungajuni.
Given the rate of cases spreading down south, should we expect to see cases of COVID-19 when the southerners come back up, I guess?
Isumagillugu amisualuugiaqpalliammata tamakkuninga qallunaani nuvajjuanartaapalliayu tamaani niriunaqqa
Yes.
We're just going to do one more. Okay.
Go ahead.
I think everyone has had a. Did you want one more quick question?
I do have one more quick question.
Okay.
Dr. Patterson, Kent Driscoll, APTN National News. You mentioned the 14-day isolation in your opening remarks. For clarity, I'm wondering, could you describe who that involves, what the expectations on the people are? What exactly did returning Nunavut need to do?
Kent Driscoll APTN kunnitaakua ulluni 14 yanitteiliqattariaharniq tukisinartigiarlugu kikkut ammalu kisuniknerugiahaqqita tamakkauterniartut anitteiliqattariaqalaarninginni.
For the first 14 days after returning, stay home or stay out of other people's houses or other buildings. If they need to go get groceries once a week, if they need medical care, obviously we're not going to stop or recommend against that, and not have other people over into their own house.
Taakua ulluni 14 ni utersimalertillugi anitteiligiaqaqattarniartut angeqarsimatuinaqattarlutik pulaariaqattangillutik baluiqqanayarbinnuissiqattangillutik pinasuaqussiuiluani ataussiani uveriaqattarunnarlutini ritsaiminik anniarbiliaqattarunnarniartuugalu atamanna nuqqangatigunnanginnattigu ammalu pulaariaqattangillutik kaakkuatankapidjutingin.
Well, thanks so much, everybody. We are done for today. It's a revolving situation, so as necessary, we'll be doing these media conferences. So stay tuned throughout the holiday season. If there is a need or any updated information or restrictions, we'll have another one of these media conferences to update everyone. The best way to keep in touch is just monitor social media as well as news outlets. Thank you to CBC for continuing to rebroadcast.
Tusaqtitsiaqattalangajugunutaani tussaqatsaqartuhaqaipatamaaneqikarnautillugu ammalupipalliajutigu qauyigiaqattaqunarniarsusseqanuipallianiujumi.